Again, I'm Dr. Fuentes from the Fuentes Cosmetic Surgery Center. The last time we spoke, I told you I was going to talk to you today about the glabellar frown lines. Before I do that, I will talk to you about how muscles work and how Botox works, because Botox is the most common way to treat the glabellar frown line. The Botox works by blocking the conduction between the nerve and the muscles. So, if the brain tells the hand to move, it goes through a nerve into the muscles that move the hand. The Botox block it, and therefore it cannot move. All the muscles of the body are balanced. So the muscles that bring the wrist up, located on the dorsal aspect of the forearm, are balanced with the muscles, as an example, that bring the wrist down. So if I stop the muscles that bring the wrist down from working, only the muscles that bring the wrist up work. The same thing applies to this area here. There are three little muscles here called the procerus and the corrugator muscles. They are balanced with the frontalis muscle. The corrugators do that. The frontalis muscle lifts up the eyebrows. So if I stop these three muscles from working, these 11 lines relax. At the same time, the eyebrows go up, because now the frontalis muscle is unopposed. So the Botox is used for the glabellar frown line, elevation of the eyebrows, and the treatment of the forehead wrinkles. Now you have to be careful with the Botox not to give it too far laterally, because you can develop this witchy look that you will not like. You also have to be careful not to give the Botox too close to the eyebrow, because if you give the Botox below this distance, the brows will come down and it will crowd the upper eyelid skin. The duration of the Botox varies from person to person. It usually lasts about 3 months, although you can make it last longer if you increase the units that you give. I usually give the patients about 15 units, but if you give them 40 units as an example, instead of lasting 3 months, you can make it last approximately 5 months. The good thing about this is that there's no downtime. You can go and do your thing that day. You have to be careful not to drink alcohol that day, because it can make you have more black and blue. You should also keep in mind that it could take several days for the Botox to work. I might give it to you today. It might take a couple of days, sometimes even a week before you see the results. So those are in general the treatment of the 11 or glabellar frown line, which could also be used for treatment of forehead wrinkles and eyebrow elevation. Remember, as I told you in the past, you can treat the forehead wrinkles in a more permanent way with laser, dermabrasion, and peels. I hope I gave you enough information and that it was helpful to you. I think the next time I'll talk to you about the eye surgery, and looking forward to seeing you again and talking to you again. Have a good day. Bye.